I'm super excited to have Maya here today with us. She's going to be talking about perspective of a professional working in the field of autism, registered behavior technician, instructor therapist extraordinaire. Welcome, Maya.
Thank you for having me.
Thank you for being here. So, let's chat about how you got into this world of autism, developmental disabilities. Where did it all begin for you?
It definitely began in university. I was in my first year and summer hit. So I was a psych student doing my undergrad, and I had a family member who was also really into ABA. So I decided to look at working with children and volunteering with kids. Actually, that summer, ended up being with adults. So ended up volunteering with like an older range of adults in a program, and we did a lot of outings, and I absolutely loved it. So I really loved connecting with the people that I was working with. And then I could definitely see the things that we were doing in terms of outings, there were some like gaps. So I was just
Mm.
always curious about like, oh, what if we did certain things another way? So one of them was I remember this girl. Um, she had a really hard time wearing her shoes. And she was actually my age. So I was working with somebody who was my age. And her parents had wrapped her shoelaces around her ankle and then tied a knot so she couldn't kick them off. And I was like, wouldn't it be interesting if she could just keep her shoes on?
Mm-hmm.
So that's kind of where everything started.
Yeah. What a great question. This is something that we see as practitioners a lot of times that families are just doing their best to get by and sometimes just making adjustments within the environment just to make it through. She's got to keep her shoes on. So what can we
Yeah.
do? We got to like wrap it around multiple times. And one of the most beautiful things I think about behavior analysis is the repeated demonstration that any person, it doesn't matter who you are, including individuals with developmental disabilities and autism, can learn and that we can strive to raise the bar. And in fact, it was people in ABA that demonstrated this really early on back in the, 60s, showing the incredible capacity for individuals to learn that traditionally people maybe thought couldn't learn certain skills. So the fact that you saw that and you asked that question is like, that's a beautiful way to start a career. Like, let's see. Did you try anything at that point, or this was just a question for you
This
in your
was
mind?
definitely a question
Yeah.
for me.
Yeah. Like, is there a better way?
Is
Yeah.
there a better way?
Yeah.
For
And
sure.
then, led you down a path to, well, there sure is.
Yeah.
Right? Like, absolutely. So that's amazing. So you spent a summer. This was like a summer as a student
Yeah.
yourself, working with individuals, some of them the same age as you,
Yeah.
which is incredible. I mean, somewhat unconventional these days because a lot of stories I hear, including for myself as a professional, I started with kids,
For
right?
sure.
So you worked with what was the biggest impression that you left with that summer from that experience?
So I definitely, actually, let's backtrack. So a lot of the individuals that I were working with, some of them were toilet trained and some of them
Mm,
weren't. So my biggest impression that I left with was doing something better for the adults. So there has to be something better that we can do
yes.
for adults if they're not toilet trained or if they're wearing diapers. So I mentioned that I was working with somebody my age. There were also individuals that were older that I was working with as well that weren't toilet trained. So it's all about, so when I left where I was very much like, there has to be something that we can do to make sure that, as adults, we can, we all have dignity. We can all go to the washroom when we
Yes.
need to use the washroom, and we're not just wearing a diaper.
Absolutely. This is one of my big things. It comes up, it's a theme,
Yeah,
comes up in conversation, maybe a little bit way too much, but it's something that I'm really passionate about as well, is the ability for individuals who have developmental delays, autism, to be toilet trained because it's a game changer.
for
It's a
sure.
life changer. It's a quality of life indicator. And I personally believe, I feel very strongly about this, that because we have the technology to teach toilet training, Every individual should be able to be toilet trained. And when they're not, it's a human rights tragedy. It's an infringement to go through life. And you've met individuals that this has happened to. I have too. People aren't typically exposed to this and they're shocked by this, that there are individuals in their 40s, 50s, 60s, even who are in diapers and they don't need to. And it's terrible. There is a better way. I agree with you. This is something that I worked with kids in my early career, but I also had some exposure to adults, and I was greatly impacted by that too, by
Absolutely.
individuals who are like adults in diapers. This is wrong, and we need to completely pivot on this issue as a society. So that exposure really impacted you.
Yeah, absolutely.
Yeah.
Because at the end of the day, there are some facilities, like when you go outside, you may not encounter like a family washroom. You may not encounter a lift. So when an individual is wheelchair
Hmm.
bound or uses a wheelchair, sometimes you need to like hoist the individual up onto a table in order to change them. And again, so you need like an adult change table almost. So this is definitely like it definitely impacts the individual, and I've seen it for myself. So it's definitely understanding that they're limited in terms of where they go, right? And like if they're allowed to like go on outings, simply because they may not be able to use the bathroom.
Exactly. So really the quality of their life completely
Yeah,
changes, let alone the fact that you need somebody to help change your diaper as you get older is just from a dignity and independence perspective is just so wrong to me. And
absolutely.
vulnerabilities as well. There's like just so many layers to this. So this was like a major turning point
Yeah,
in your professional career in your life to be
absolutely.
exposed to that. So you finished the summer and then like what happens?
So I finished the summer and then I actually ended up finding another place to volunteer at. So I was volunteering at a place where we did more outings, but it was also teaching older kids how to like use the bus
Yeah.
and how to subway. And it was great. It was an amazing experience because it's a life skill in order to get from place to place and know when to change and where to go in order to take the subway and take the bus.
Right. What were some of the things that there's so many layers to this too, right? People outside of the autism community, especially like the teaching autism community, you don't really appreciate the complexity of just everyday things
For
that we
sure.
do, right? I know I didn't before I was in this world. You just get on a bus, you know, okay, yeah, it's a big deal when you're a little younger, you learn to take the bus. But in order to break that down into small steps to help individuals with autism, there's got to be a lot of thought
Yeah.
into what they do. So, what were some of the things that you guys were helping prepare individuals, adults for in the real world when it came to transportation?
So the first one is time. So usually there was an activity at the end of the commute. So
Right.
there's always a goal.
Yay,
So
something fun, right?
exactly.
Yeah, yeah.
So keeping in mind the time. So what time is it? What time is that bus? What time is that subway? Being patient, right? When you wait for the
Mhm.
bus, sometimes doesn't come on time. You got to wait a little bit,
Yeah,
making sure you have everything you need. So do you have your bus fare? Do you have your tokens? Do you have your Presto card in order to pay to get on the bus or
right.
the subway? And then, oh, let's make sure we all stay together. And then we all exit properly. So making sure, okay, yeah, when you go on the subway and you use the subway, holding onto the railing, letting people that are like quick pass by you and moving out of their way, and then entering your fun activity, whatever that is.
Yeah. Amazing, right? And taking the time to teach all those steps and help
Absolutely.
people, again, game changer for them in their lives.
For sure.
And then of course there's like the unpredictability, like could miss the bus. I mean, there's so many different pieces to this, right? So you're volunteering. So now you've coupled, okay, I want to help. I guess was it just autism or was there other needs
There
there too?
there were other needs there as well.
Yeah. So oftentimes what we see in adult services, right? Like
Yeah,
there's
absolutely.
a range of developmental disabilities, autism being one. And so you've gone from, okay, let's have some kind of fun recreational type support to now recreational community based support, added layer of teaching.
Exactly.
Amazing. And then where'd you go from here?
So then I continued doing and volunteering throughout university. And then I finished my university degree.
Yay.
And so I started looking for like meaningful work outside.
Hmm.
So I found Breakthrough.
Okay.
And it was really great.
Yeah.
I really loved everything that the kids were being taught because I found it meaningful and impactful for when they would be adults.
Yeah. What so in university, right? There's a lot of there's a lot of growing up in
Yeah.
different ways for yourself, and decision making that happens. You said you were studying general psychology at the time.
Yes.
Okay, so you're an undergrad, you're studying general psychology, you're working, so you're definitely hustling and that's a lot you've got on your plate to begin with. And this is like to be fair, you're a very optimistic person, which is amazing. But it's tough too. Like there's
It
days that
was.
it can be really tough, right? And it makes the job even better when you get through that stuff, but there are times that can be challenging. What pushed you, or what drove the passion in you to decide that there's so many different angles of psychology that people can take, that you decided this was the path from that undergrad university to I'm going to look for a job in this area.
So I remember doing a developmental psychology class, and I just kept on thinking about it's like we were learning about typical development,
Mm.
but I was always talking and thinking about atypical development. So there's not enough literature that like we were studying, and I was just really interested in it. So I thought, okay, let me see what I can find, even if I'm just like volunteering. And I really liked what I found. And I found that it was more impactful and the literature didn't do it justice because every child is so different
Yeah.
that it would have to be like a case study versus like a general diagnostic on like the DSM-5. At least this is what happened when I was in university. It
Mhm.
was just like this definition of autism, but it didn't classify anything else. It just like some characteristics. Didn't talk about like the kids and who they were or the parents and who they were. The most impactful thing was the first set of parents when I left the place that I was volunteering.
Mm.
And you just know that like the parents care about their kids just as any other parents do.
Mhm.
And it's definitely life changing for them when they meet another caregiver who cares enough about their kid just like they do. So they know it's like, I trust you with my child. I know that
Yeah.
they're in good hands for the whole day and I can go home and I can relax because that's all a parent really wants.
Amazing. It's huge. It's so important for people who are working in the field of special needs, autism, ABA, other disciplines within developmental disabilities to hear this,
For
right?
sure.
Because we look, the textbooks are the textbooks, right?
Yeah.
You need the technical skills and there's only so much you can get out of a textbook. What they don't teach you is maybe this will change, we hope it will, but it's outside of the textbook, it's the human lives,
For
right?
sure.
And it's not just the kids, it's the parents, it's the family, it's the community. And what you discovered, um, good on you to make that realization, is that the trust, the connection, we hear this from this is a major factor that parents consider outside of just can you help my child learn how to keep on their shoes. This is
Right.
important too, right? But who can I leave my child with and go home and like breathe? This is, it's really important, and that professional connection comes from, and I know you have this because it just exudes from you. It's the care, it's authentic caring. You really have to feel
Absolutely.
that, right? And the nice byproduct, aside from the child, adolescent, adult learning, is the parent has a break too.
Absolutely.
This is huge. Like they can go home and they can just not have to worry 24/7 about their child, or even feeling comfortable leaving your child somewhere is a major gift. It's a major gift that you give to actually the professional to say, I trust you.
For sure. Absolutely.
How did you build that with families?
I would say you build it by it takes a little bit of time,
Yeah.
but it's definitely understanding like every family's different. What they want for their child is completely different.
Yeah.
So understanding that, hey, I know that today, like it's really, really big for you that, your kid says bye to you, right? When they leave. So I'm gonna make sure that they do that.
Yeah.
When you come back to pick them up, I'm gonna make sure that they say hi to you, even if they just look at you to say hi. Or and also to like make sure that the parents know it's like what we're doing is like meaningful to you at home, right? So like this is what we're doing.
Yeah. I looking from their perspective in terms of
Absolutely.
what matters, right? Again, a lot of us come into the field with some level of technical expertise or schooling or whatnot, and we continue on that journey. Some of us longer than others. You know, not enough to do undergrad to keep going, but and that's all good and important. But that's their child. Like, they know more. They're the experts. I always say we're the ABA experts. The parents are the experts in their child, right?
For
So to
sure.
hear that and tailor whatever type of programming, whatever moment that there's an opportune moment to not only do something that's impactful for the child, but also the family is just like such a beautiful thing to do that.
Absolutely.
Yeah. And that you're thinking about that is amazing. It also means the families are going to keep coming back. Right.
For
And
sure.
it gives us an opportunity to then continue to make an impact on that child. Right. Because they live within the ecosystem of their family.
Absolutely. Like,
Yeah.
we're only with them for like a fraction of their lives.
Yeah.
So it's really like the parents and the
Yeah.
caregivers that are really going to be doing a lot of that work. And we're here to like support them and their cohort and the community around them.
Amazing. So this was something that also has driven you in your career too, in terms
Absolutely.
of entering into it post university and continuing along the journey. So so then you moved from adults to kids. What are some of the things that you took? Because it is a really interesting and important perspective. And I say this to a lot of people who are working in the field too. If you ever have an opportunity to have some exposure to adult services, I think it's really important. What are some of the things that you took from that experience and brought into the other aspects of your work with the littler ones?
So definitely with like all kids, right? It's like it's easier for them to like learn certain things when they're younger. So
Yeah.
it's like just things like greeting somebody or even getting them to do things like if they can learn to tie their shoes at an earlier age, that's great. Or even toilet training, asking for the
Mhm.
bathroom, even if they need help, right? So it's okay for them to, not all kids can just go to the bathroom by themselves, even at 3 years old or 4 years old, right? But they can, some kids like whisper it to their parents, right?
Yeah.
Like, I need to use the bathroom, versus some kids, oh, just to communicate with a picture, like, I need to use the
Mhm.
bathroom, or with an iPad that they need to go. So, um, getting them to communicate in general is really, really huge, because working with an adult population, there was sometimes a gap in terms of communication. So, if you did see an adult that was upset, and if they just wanted a toy
Yeah.
and they weren't able to express that they wanted that, I would have been happy to give it to them. But the communication is really key, because then they could have exactly what they want. So, just teaching like kids when they're young to ask for the things that they want in whatever means,
Yeah.
communication is like definitely the way to go.
For sure. That's a huge one for people to keep in mind. And sometimes when they're younger, what happens, and I know I've done this as a parent too, and my kids are not on the spectrum, but we get to know our kids really well. So it's, as parents, we can meet their needs. We
Yep.
can, even they don't even need to tell me, and they're capable of telling me. But I'm just gonna, get them things that they need or that they want, arrange the environment so that they're comfortable. And by all means, parents should do that. But at some point, kids grow up, they become adults, and parents aren't always going to be there to be able to interpret those needs if they are not able to communicate them. This can lead to some really significant challenges,
Absolutely.
right? So that's a really good takeaway from all of that. Absolutely. So we mentioned, like, there's some days that are shining moments, and we got the high to the parent, and that's, oh, amazing. The reality is there's, some tough things that we work through, and that's why kids, adults, adolescents go to treatment,
Mhm.
is to help them overcome those things. But there's another side to this. There's people who are helping them, people like you that are on the front lines every day to day. So, how do you work through that stuff? Not from a technical standpoint. I know we have intervention plans and we figure all that out,
Right.
but you're a human being too. And we want people. We're so lucky to have people like you in the field. And how do we keep you go? How do you keep it going? What keeps you going through all of that?
It's really rewarding, even though there are hard days.
Mhm.
I
Of
mean, even parents sometimes have like really hard days, right?
course they do.
Everyone
Yeah.
does, right? So this is no different. So, everyone has bad days and everyone
Mhm.
has really good days. I really like to think about the good days and not to let them not to let the bad days outshine the good days.
Mhm.
The reason why is because that day will end and tomorrow's a new day. And sometimes that's exactly what that kid needs. Sometimes, they just need a really good night's sleep. And then the next day, everything is great. Or they just really want to see mom or dad. And they'll see mom and dad. And then that's okay too,
Yeah.
because we're also teaching them, right? It's like, okay, it might be really, really hard right now, but it's going to be okay,
Yeah.
whatever it is. So even if you have a bad day and, you'd like to cry or you want to like tell us how you feel about it,
Yeah.
that's great. That's still teaching you how to like let others know how you're feeling, right? That's
Mhm.
huge. So that communication piece again is really crucial. It's okay to have bad days.
That's such an important thing for us. Well, for us, it's a life lesson for us. It's also a lesson for the kids to not just focus on, well, they're going to have like whatever 100% on this or that, or we're teaching the skill and yay. And it's, of course, we want to celebrate all those successes. But the reality is we can't just say, you know, we don't want you to do that. Or, if someone takes your toy from you, okay, sure. We'd like them to say it's okay and, move on. But hey, like that's crummy. Like
Yeah.
it's okay to say that sucks. Or it's okay to say, I had to wait for something and it's really hard to wait for it because I really like it. And it's something that we need to recognize as we help support individuals with ASD in the community, that it's a skill to be able to just say it kind of sucks. And then
Absolutely.
just you could be upset, just like us, right?
Right.
It runs both ways, absolutely. The optimism in you runs deep, my it does. You have such an optimistic framework to think, okay, tomorrow we keep going, right?
Absolutely.
Yeah, yeah,
And I'm sure when we were kids,
yeah.
we also tried to like take that toy
Oh, we
back,
sure did.
right?
Yeah,
So hindsight is always
yeah,
2020. I
yeah,
was a perfect child. I wasn't,
yeah.
right? I
Hindsight,
definitely got
yeah,
upset
yeah,
when, someone took a doll from
yeah.
me or I couldn't have a turn. And it's hard for all kids,
It
right?
sure is. Yeah. Sometimes I joke, like like when my kids were younger, hopefully they're not watching this, but that like, oh, some of those programs would actually be good for my kids who are not on this. Like some of the things that we teach kids with ASD is so much more sophisticated than some of the things we see, in terms of sharing and overcoming challenges and stuff like that. These are like things that come up in development, albeit it's more pervasive at times. That's why we work on it in intervention. But the developmental perspective, which maybe you got through psychology as well. You learn a little bit about child development, and you're like, okay, this is stuff that happens, and learning happens to grow from there.
Absolutely.
Yeah, same as us as professionals,
Right.
right? Yeah. So the optimism helps carry you through.
Absolutely.
What else? What else? What are some of the joys of your professional career?
Working with the parents is amazing.
Mm,
I love working with the parents. Um, Everyone has their own story and everyone is so individual and everyone has very different goals for their families. So it's just interesting. It's actually like a really big privilege to have like a snapshot inside of their life in terms of what they would like to achieve. Because I'm just here to help them do that.
mm,
Right. So whether it's just like having your kid identify what something is. So if they would like it, they can ask you for it. That's huge. Right.
huge.
Versus, oh, I just want to have like dinner with my whole family, including my child. That's huge too. Or even having your child help prepare a meal. Clearly, like I run everything around like food and meal
Yeah.
times. And it's like, okay, absolutely.
I got this. I can help you with that. Yeah. Yeah. That's
So
great. It is a privilege. I often say that we have within our profession a great privilege and responsibility, that we get to help the kids we do and the families. Such a beautiful thing that
absolutely.
they let you into their life, let you into that window to hear what matters, and then you're able to help them. It's such a tremendous gift that we have. It's amazing, and it's really interesting to hear. You know what I think sometimes, like we do all these clinical assess we call them skill-based or curriculum assessments, right? And they're really important, and because we need to look at key developmental milestones and all that stuff. But the most important thing we can do is just ask a parent what matters, and teach that, right?
for sure.
What are some of the things that you've taught? Anything that comes to mind, you're like, oh, that's interesting. Like I wouldn't have thought of that. What's meaningful to a family is it can be very different than what we, think is matter. Or I wouldn't even consider some of the stuff that they share.
For sure.
Yeah.
So, I've had parents ask me to like teach their children like modesty.
Right.
So
Yeah.
sometimes it's like on a religious basis,
Yes,
right? And
absolutely.
like this is
Yeah.
really important for the family
Um,
because this is what they do at home.
Right.
So this is how they keep everyone kind of like they teach their other kids the same.
Yeah.
So we're gonna teach our child, even though our child might have ASD, the same thing because it helps us at home. And this is really important for us in our cohort, in our community. So they need
Hmm.
to learn this. It's very important. Something else is toilet training at home with the parents is
Hmm.
really important too. So sometimes even like, if like your child is having like a hard time with something, oh, okay, great. Let's talk about it. How can we help you? So toilet training is like smoother at home
Yeah.
because in a clinical setting, everything's a lot more
It's
different
different. Yes.
versus at home if
Yeah.
you have another child, right?
Sure.
Absolutely. You got to cook dinner too.
Yeah.
Absolutely. How can we tailor it so it fits to you and you can do it too?
Yeah. And the dynamics of siblings, if that's the case, considering those needs as well. Even just something as basic as like we teach the kids to ask as you would do with littler ones in the classroom, right? You just don't get up and go to the bathroom, so they need to ask to go to the bathroom. But at home, families are no, just let them go.
Yeah,
That's totally appropriate. It doesn't need to ask to use the bathroom. Like there's nuances, right, in transferring skills over to home.
absolutely.
Yeah,
Yeah.
yeah,
Or
totally agree.
even like a parent
Yeah.
asking an instruction versus a teacher,
Yes.
right? Very different. It's like, wait a minute, my teacher asks me this. Or even if like your sibling asks you this, we want you to be able to like have like the generalization of skills
Hmm.
across different people, even if it's a teacher, not a teacher, or you're asking your friend to give you something, right? Whether it's like, hey, can you pass that pencil so I can write my name on the paper?
Yeah, absolutely. You as a professional, what are lessons that you've taken from your work?
Don't move too quickly. It's okay to kind of just like step back and take a minute, evaluate everything, and then decide to make a decision.
And you learned that from your work.
Yeah.
How did you learn that?
I remember there was like a lot of commotion, a lot of noise,
Yeah.
maybe some challenges that we were going
Yes.
through.
Yep.
And I wasn't personally going through it, but I could see everything in slow motion in front of me. So I
Hmm.
just thought, isn't it interesting to just take a second to slow down, to see everything around you before you make a decision?
Very good. Yeah. To
And
help support the situation.
exactly,
Yeah.
because sometimes the person in the situation might have tunnel vision. So they might only see a
Yeah.
certain perspective.
Yeah.
So even them taking a break or even you kind of just seeing the whole picture, okay, what's my consequence or what's going to happen if I do things this way?
Yeah.
Okay, sure, let's give it a try.
Yeah. It's a good lesson because it's ingrained in us in that helping profession, especially with ABA, that we are the helpers. We can go in and we can teach. And this is all very important, right? We want to jump to solution focused,
For sure.
things because this is what we're actually really good at this. We can teach all kinds of things. This is incredible. We change lives this way. But at the same time, there are times where it's reasonable and necessary to stop, pause, think. Even okay to say, like, I'm not sure, let me get back to you. This is a skill that it's an important skill to develop, not only in a career, but also in life, right?
For sure.
Sometimes you come up with way better things that way.
Yeah. And
Explore, investigate, get more information, whatever you need to do, understand. Don't need to jump into everything.
no, and it's actually really great if you can take a minute because if you feel overwhelmed for whatever means
Yeah.
or whatever reason, you get a minute to just, oh, okay, I can
Yeah.
just take a second.
The kids pick up on that too, right? Like if we're more grounded ourselves, right? This is not a technical thing per se, but it impacts what we're able to do. If we're able to go in there like, okay, collect myself, you know, and I can go in there as opposed to rushing in and sort of, okay, trying to diffuse the situation too quickly.
For sure. And your emotions are definitely like the physical attributes of you moving very quickly,
Absolutely.
right?
Yeah.
Versus, oh, okay, moving very calmly and just, not responding to things right away. Because usually sometimes it's, why aren't you responding right away? Oh, I'm just taking a minute.
It's a skill to develop that for sure. Absolutely. In your example, too, you were seeing from sort of an outside perspective. So you've gone from, which you still do quite a bit of, like some frontline service delivery, but you also help train other staff and help people enter into the profession, which is a beautiful thing too. It's another way to increase the impact of your work, starting from where you started and then, gaining skills and being able to move up. What are some of the things that help you help others learn how to work with the kids and work with families? What are some of the skills that you've taken from that?
Everyone has their own story,
Yeah.
right? So everyone definitely has like lots of wonderful things to contribute. And I love seeing them grow. So sometimes they'll see other instructors or other staff members and say, oh, I can do that. Oh, that's a great idea.
Yeah.
And then that becomes an even better model for other people too. So whether it's just, oh, instead of just like dealing with maybe some challenges, right? They take a minute, they take a step back. Oh, okay. Do you want to talk about it?
Hmm.
Let's see what we can do for you first. Okay, sure, that sounds great. Okay, let's do that. Having a conversation, right? And I really like seeing staff come in sometimes being unsure of what to do and learning, oh, okay, great. I know how to do and how to de escalate a situation. And they feel really confident about themselves because parents do it all the time at home, right?
Right.
It's like, if one child is fighting with another child, well, okay, let's talk about what happened,
Hmm.
right? In a professional setting, it's very different.
Yeah.
So you have to come, you have to look at look at the child that you're working with or the adult that you're working with, and, potentially talk to them, see what they would like, what's upsetting them. Okay, great. And work through that together.
Hmm.
And you definitely bond with your child over that, right? Because, like, you can go through some tricky
Sure.
situations. And then
Yeah.
after, you're like, oh, okay, great. I'm glad that we got through that together. I'm glad that, you're happy. We're back to playing together. Everything is great. And that's definitely like a bonding experience. And
Mhm.
parents get that at home too,
Yeah.
right? So do siblings.
Sure. And so helping staff work through that stuff
Exactly.
is, and also seeing the child's growth with that too. You get a 2-for-1 deal.
Exactly. It's great.
Yeah. What are some of your favorite things that you've, accomplished with other staff, like helping people? Is there any memorable moments that you have?
Oh,
Yeah.
absolutely. So sometimes new staff, especially if they're like brand new out of school, sometimes they're a little bit apprehensive in
Sure.
terms of working with some
Yeah.
kids, especially if they're just observing and something might happen
Hmm.
that they may not expect,
Yeah.
or something gets thrown, or
This is real.
this is real.
That's why they're in treatment. Yeah.
And just seeing initially the pause
Yeah.
and then, okay, and then seeing them work through it and that growth
Yeah.
is huge because now okay, great. I've done my job,
Yeah.
right? You feel comfortable, you can keep that child safe and you can keep yourself safe. And that's the bare
Amazing.
minimum. That's where everything starts.
And now we can teach.
And now we can teach.
From kids' perspective, memorable moments, things that you've accomplished with a child that sticks out in your mind.
I remember working with a child and they could not drink from a cup. And now they can. And that is amazing. Like,
Yeah.
just in terms of a skill.
Yeah.
When you go to a place, even McDonald's or Tim Hortons, they don't have sippy cups available. So if you, as a parent, forget your sippy cup at home, or if you go to a restaurant,
Mhm.
they often don't have sippy cups.
Mhm.
So if you forget it, as parents do, you'd love to ask for something for your child to drink out of, even as an adult, right? Most adults don't drink out of sippy cups. They drink out of regular cups.
Sure. Yeah, this is so many layers again to this, like drinking out of a sippy cup when you're an adult, it's going to be a hard time finding
Absolutely.
friends or, getting around in the community.
For sure.
People don't realize this too, right? That there are certain stages of development that unless you actively treat that particular, stage, let's say a child may not move through that. So, for example, do we have kids who drink out of sippy cups that are 8, 9, 10 years old? Bottles, even drinking out of a bottle. How'd you move from that to the cup? How'd you get there?
So,
And of course, it's all individualized, and
for
we
sure.
know this, that every child's different, but just sort of the stages of progression from the child's perspective, but also yours, right?
Absolutely. So, just seeing what the child can do. So,
Hmm.
does a child have the skill to like slurp? Like, when we eat soup,
Yeah.
sometimes we like slurp and to suck in a liquid. So, it's having certain skill acquisitions and learning from that.
Hmm.
And it was huge for me just to see the progression
Yeah.
because that goal is so huge at the end of the day, right? Just being able to drink out of a cup, which I take for granted. So many people
Yeah.
do. But some kids, some adults have to like work through it. And
Yeah.
that's a really important skill. And they should be really proud of themselves that they're able to do it.
Yes. Absolutely. Because it's a lot of work to get there,
For sure.
right? So, also, how long did it take to get there? Give or take. Let's
Mm,
just say
A couple of months.
a couple of months, right? So this is to appreciate this is something that was practiced,
Yes.
right? Over multiple occasions, over months, like within sessions, across sessions, right? So we know that this works, right? Repetition helps facilitate learning. We mix it up with different stuff, right? We're not just doing the sippy cup thing all day. Um, as an instructor, you're coming in from this perspective of, okay, got a bunch of things, right?
Yeah,
And I got to practice them. Then you come back the next day and you do it again. And the next day you do it again. And let's be real, we're humans too, right? We, want to mix it up and change it up, but here you are applying something that we know works. The child needs practice. We have some fun. We, have breaks. We make it exciting and functional, but there still is repetition. From a professional side, how do you get jazzed about that? Work on that. Say, okay, today I'm going to come back and I'm going to do my whatever amount of opportunities that this child needs on whatever skill. In this case, sippy cup, but it could be anything to work through that.
for sure. So sometimes it does get repetitive.
Yeah. Yeah.
Absolutely. And sometimes you're just like, "Whew, okay, gonna do this program one more time,"
Yeah. Yeah.
which is fine.
Yes.
It's kind of just to push through. So for myself as a professional, I'm like, okay, great. Let's decide what we're gonna do together afterwards. Let's do something fun. Do you want to go outside to play? We're gonna do this.
Hmm.
Because at the end of the day, it's not about me and my sense of repetition or what I feel is overwhelming. It's they need to learn a skill that's going to be really beneficial to them when they get older.
Absolutely.
Because when I've been working with adults, I've seen how beneficial it is to have early intervention as a child. So I really want to push them.
Yeah, it's like the why it helps anchor you
Exactly.
and the perspective of the what's the outcome here?
For
Where are
sure.
we go? Where are we headed here with this child? Any specific skills that you can think of that you say, okay, I helped this parent with whatever, or any
Absolutely.
moments that a family said, Maya, we got this.
Definitely crossing the street,
Crossing the street.
which is amazing.
Yeah.
So just being able to just have the skill in order to, okay, if you see a moving vehicle, what do you do?
Mm-hmm.
In order to like look both ways and then to cross the street and having this translate because this is reflective of their own independence, right?
And safety. Safety is a
Absolutely.
huge one. Game changer for families. So you work with some families on together, how do we teach child to safely cross the street? And then this is also something that you can leave with the families too.
Absolutely.
Any thoughts on, because this is not an easy thing to do. So you're coming in, we're younger, typically I was younger. Professionals, they come in and we're showing parents strategies to help their children. And so the trust issue is something that's very important to consider, connection and building all of that. How do you help a family learn some of these things? We're not going to be able to teach a child everything,
For sure.
right? It's never going to happen. Like, we're there for a snapshot. We've already talked about this in a child's life, this much if we're even lucky. And a child's going to learn, we're all going to learn, hopefully, for our whole lifespan. I mean, that's what improves the quality of our life, right? And so some of it is not just what we do within our treatment settings with the children, but it's also these amazing gifts that we can impart onto other people, especially the parents, right? Education, similar, if we're lucky enough to be able to work collaboratively with teachers and EAs and whatnot in schools. We can also, work together to show them some strategies that we think might be helpful. From the family's end, though, it's a sensitive area,
For
right? They're
sure.
trusting, you've made the connection professionally to help support their children. And here you are, it's like ground zero. Let's help build some skills so that I always say our job's to put ourselves out of a job, right? So,
For sure.
how can I put myself out of a job? What are some of the things that you found to be helpful in working with families to help impart some of those gifts onto them?
Absolutely. So listening to them. Sometimes when you walk into another person's home who you're working with their child, not everyone has had a great day. And sometimes
Hmm.
you're their first point of contact.
Yeah.
So if they've had a bad day, just to listen empathetically. It's okay. Everyone has bad days.
Yeah.
And it also is a great piece of information for you to use going to work with this child, because now it teaches you, okay, so maybe they haven't had such a great day. Maybe we can do something in their programming that is going to be beneficial for mom or dad to hear. So let's work on that today since they've had a hard day. And then coming out, if mom and dad are there, sometimes they watch, sometimes they don't. But at the end of your session, you tell them, this is what we worked on today. And they did a really good job with XYZ. And if they didn't do a really good job, it's okay to say that you worked on it and you're practicing it,
Yeah.
because that's what's going to one day be that really great job. It's that practice piece and that practice component, right?
Yeah.
So, today he didn't get what he wanted, but we really practiced our calming strategies. So we practiced staying calm when we didn't get what we wanted. And you know what? It's hard when you don't get what you want.
Yeah.
And a lot of kids deal with that too.
This is really important that it's keeping it real, right? So we want to celebrate all the successes, but the reality is that treatment is there for a reason. It's necessary for some, not all, but for some kids and at certain stages. And it's important that we communicate, right? All the great stuff, but also the realness of it. And if there are things that are of a challenge, what are we doing to work through that? Super important, but also being open and honest to lay the foundation for ultimately the ideal is if we can help work with the family on some of these skills. Any meaningful skills that you've imparted on to families? So we've talked about, the kids, the sippy cup, transition to, drinking out of a cup or a glass or whatever. That's massive toilet training. What about for families? Any moments of memory for you?
In general. So
Hmm.
a lot of families that I work with, I'll like video model certain programs that we do.
Hmm.
And when they send me videos back of them doing the same thing is amazing, because I know that like they took the time out of their day
Yeah.
to sit with their child and practice whatever it is. It's
Yeah.
amazing, right? That they're really committed and they share this with us. And they're just like, yes, and let me know how I did
Yeah.
and let me know what I can do to make it better. And I absolutely love that, because it means that they really care in terms of doing this at home with their kids, and also all of like the work that they're also putting in at home, which isn't easy,
No.
right?
Yeah, amazing. What are some of the things that they've shown you that they're doing? Give some inspiration to other families who may be watching out there that
For sure.
parents can do. Parents can do some. We don't expect parents to be therapists. I always say this. That's a different.
Yeah.
I feel that as professionals, we have a lot of responsibility to do the heavy lifting because of what parents, go through on a day-to-day basis, but certainly we can impart a lot of strategies that of things that come up in everyday life and they can make a meaningful impact on their kids. So certain things that maybe you say, okay, parent was able to do this with their child.
So, like, dressing is teaching the
Yes.
child to, like, be independent, however that may be, and
Mm-hmm.
it might look different. It may not look like the child is independently putting on their shoes. It could be that they're doing parts of it
Mm-hmm.
independently. That's fantastic. That's still shaping up the child's independence, and it also is, like, amazing for the parents because then the child knows that, "Oh, okay, I do this with my teachers, I also do this with mom and dad." Toothbrushing. That's a
That's
huge
a good
one
one. Yeah.
because toothbrushing can be quite tricky. And it, again, not all of the steps need to be done by the kiddo.
Yeah.
Some steps can be done by the parents.
Yeah. And then slowly transfer, but there's steps involved in that. Absolutely.
Absolutely.
The toothbrushing one is such a good one because it's not one that you can go, okay, let's practice that again. Even like 5, 10 minutes. It's a hard one to practice. You can overdo it in a session. If you over practice something like that, it becomes to a point where kids like, okay, I'm done. Like, I'm
Yeah.
not doing this anymore. We don't want to do that. We want to make things as meaningful and as fun as possible. I mean, there's some things we work on that are tough, but we want to make it in a context by which kids are running to us and not away from us, right?
Exactly.
So we have to think about all this stuff, but there is a necessity to practice. So how can we get more practice? Especially with something like toothbrushing? Well, parents, right? Parents getting involved. The other thing that some people may not be aware of is like the dental hygiene component of all this. For some kids, even putting the toothbrush in their mouth can be really, really
Tough.
tough, right? So, which leads to all sorts of added healthcare complications.
For
So,
sure.
for a family to be doing toothbrushing with their child at home can actually make the difference between something like dental surgery or
Mhm.
having to put your kid under, to sleep or anesthetics to be able to clean their teeth,
Absolutely.
right? So this is amazing if we can get parents, to help with that.
And it's huge. And sometimes, in relation to toothbrushing,
Hmm.
sometimes it's done without the toothpaste because
Hmm.
sometimes the
Got to start
toothpaste
somewhere.
is
Yeah.
something else.
Yes, that's right. Absolutely. And what's the issue with the toothpaste? Because some people might not know. Why would you not have toothpaste at the beginning?
Sometimes, because of the taste and the texture,
Yeah.
some kids either really, really enjoy it
Hmm.
or and they might try to eat it, or they really don't like it and they'll try to spit it out.
That's right. So it's another one of those, we got to take it step by there's a theme here, right?
Yeah,
It's like step by step, steps that we take, steps that the children take, and also the parents.
absolutely.
Those are amazing, amazing skills. Any thoughts on any days that you had a tough day? Any memory? I mean, I know I got a bunch. I got some I got some stories of, those in my head and, a tough day in your world and what you did to come back the next day. How'd you get through it?
I'm sure like we all have like really tough days.
Yeah.
So in terms of like coming back the next day, I like to do something and like have some time for myself
Mhm.
in the evenings or like after work, whatever it is, to like take some time for yourself or in the mornings whenever you're able to.
Mhm.
Um, I really like to go for runs. That's what I
Mhm.
like to do.
Good for you. Amazing. And
But it's not
complete opposite. That's awesome.
some
Good,
people
good.
like to binge watch TV,
Netflix. Yeah.
and that's great
Yeah.
too.
But that's awesome. That's healthy too. Good for you.
For sure.
Yeah.
Sometimes it's just a good conversation to know
Mhm.
that, other people were there too, that also may have like
Yeah.
not
The
had the
debrief.
best day,
Yeah.
right? And it's okay not to have a good day,
Mhm.
right? What matters is like, what are your wins for the day? Everyone was okay. Everyone was safe.
Mhm.
You're safe. No one got hurt.
Yeah.
And it could just be, hey, like, you know, at the end of the day, even though the day may have been really, really hard, it ended off on a positive note.
Looking for the wins.
Looking for the
Looking for
wins,
the wins. Yeah.
right?
Absolutely.
So everyone's okay. Everyone is good. No one got hurt.
Yeah.
Um, and you get to go home and do something for yourself.
Mhm.
And then the next day, everyone shows up. That's another win,
Yeah.
right? You showed up the next day.
It
That's
sure
really huge.
is. Yeah. Yeah. Absolutely. Absolutely. What are some of the most impactful things that a child has made in your life? You mentioned you've mentioned the don't jump in, right? That's
Right.
super important. Other things that have shaped you.
Oh, definitely. So just the way that I've learned so much about children in general.
Mm.
So we all get to like interact with like cousins, our own kids.
Yeah.
But when you start working with other people's children, it's a whole different ball game because now it's you have to kind of be professional, right? So you have to be a caregiver that they can trust to teach them things as well as somebody who you can have fun with, right?
Mhm.
So it's really nice to be able to just come and it's not like you're a babysitter. You're teaching them really important skills,
Yeah.
but you get to play with them and you get to laugh with
Yeah,
them. And
absolutely.
that's huge, right? So
Yeah.
even though sometimes the work is really hard, hey, but it's okay because we laughed about watching Superman or
Yeah.
laughed about some Marvel characters. That's great too. And it teaches you to connect in different ways with different kids, right? So just like adults, right? You want to be able to like find similarities to talk about. Kids are the same way, right? So you
Yeah.
want to show them those like really good conversation skills. Look, I see that you're really into this, so I'm going to talk to you about that.
Mhm.
Maybe you can try the same with me. And it becomes like a really good learning opportunity too. Or even seeing kids watch other kids and
That's
learn
amazing. That's a huge thing for some of the kids we work with.
and observational learning
Yeah.
through that is amazing. So just when you see another child who maybe I never noticed that they looked at other kids this way
Yeah.
and copying actions
Yeah.
is really interesting. And it's so amazing because it teaches you a different perspective that
Yeah.
maybe their learning is a little bit different than what we thought it was.
Yes. Yeah, absolutely. The spectrum of kids we work with, definitely. The connection, if we dig a little deeper with that, what are some of the ways that you look to because every kid is so different, right? How do you connect with them?
Absolutely.
How do you do that? What do you do? What are some of the tips that you do to say, okay, like what interests are they into? Awesome. And we dig deeper than that, in terms of, I mean, look, we're with them a lot of the
Yeah.
day for a lot of the kids that we work with. How
Sometimes
do
I let
you,
them
how do you,
play.
you let them?
I let them play.
Mhm.
I see
Yeah.
what they go after.
Yeah.
They're really interested in outside. Let's go.
Let's go. Let's make a game out of it.
Exactly.
Yeah, absolutely.
Because sometimes it's just about making it seem fun for them.
Hmm.
Because I'm sure the last thing they want is like, oh, here's another teacher who's going to make me sit at the table all day and just like stare at them
I know
and
what's
talk.
coming.
Yeah.
They're going to give me a bunch of work and I'm
Yeah.
going to run away.
Exactly. Or
Yeah.
they're talking
Yeah.
because they're about to give me a lot of work
Yeah.
versus, oh, I'm just talking to you because I'm about to play with you. Let's go play.
Yeah.
Let's hang out. Let's have a conversation. Right? Oh, let's play with some cars. And some kids, they may not communicate to us the same way. So just being able to see what they really like,
Right. Because some of them might not be able to tell us,
for
right?
sure.
So how do you figure it out for those kids?
Do they grab at something?
Hmm.
Do they gravitate towards something? Do they try to point? A lot of things it's more physical. So you want to look at their like physical actions.
Yeah.
Are they trying to like show you that they want to be picked up? Maybe they really like physical play, right? Some kids really like to spin. And
Let's
all it
go. Let's have fun.
and that's all it takes is like one good
Yeah.
spin
Yeah.
and that's it.
That's it. Now you're their best friend.
Exactly.
Yeah. The more you're having fun, they're having fun at
Exactly.
the end of the day. So going back to when you were in university, if you now learning what you've learned on your journey and you could go back to that Maya back, I don't know, however long ago that was, doesn't matter. What are some of the lessons you would tell her? What would you want to share with that
I would say you're gonna learn a lot.
Maya? Uh-huh.
You're gonna make a lot of difference.
Mm-hmm.
You're gonna have a lot of fun with a lot of kids.
Good. That's amazing. What else? What else would you tell her? That's so good.
It's a joy
Yeah.
to like work with all of those kids.
Yeah.
You're gonna impact a lot of people and not just the children, all of the families too.
It's a beautiful thing, right? How lucky are we to be able to go to a job that you're going to have meaningful impact, not just in that moment, but really for a lifetime with
For
those
sure.
children. It's such a beautiful thing that you're able to. Um, who knew that when you were starting out, right? With that summer camp, sort of notice those. You could tell her the shoes, you can do it. Well,
We can do
we
it.
can do it. We'll figure out how to not have that child or that adult, in this case, have to tie up the laces so it was parent who's worried about, their child
Exactly.
keeping their shoes on. It's remarkable. What do you want the world to know about children with autism?
They can do so much.
Mhm.
It's just about the way we see them and what we can teach them and the way
Mhm.
that they take in information and the way that they learn.
Yeah.
Every kid learns differently, just like in school,
Yeah.
right? Just like some people go to college, some people go to university, some people learn a trade because their learning styles are different. Same with children with autism,
It's a good combination that you've said because it's the abilities, it's the capability, it's the potential is there, but it's also like that's not sufficient. What you've just said is very profound in that it's also the realization of the potential. And how do you do that? You do that through access to treatment, right? It's they can learn that let's, give them the opportunities under the right environment and understanding every child for who they are, that they can learn. This is tremendous. If we could have the world understand that, we would not have any 40-year-olds in diapers, right?
for
It's
sure.
just not necessary. And thank goodness for people like you that do the work that you do. We're so blessed. I'm so blessed to get to work with you. And the children and the families are so lucky to have you in their lives. Thank you for sharing.
Thank you,
Thank,
Nancy.
thank you for sharing your story. Such a pleasure.